First of all, we want to say we're very honored to be part of the initiative and this wellness wave that the ACP Southern California 3 region has initiated. Thank you. This is beautiful. So, if I may start, my name is Mario Deng. I'm a heart failure transplant cardiologist at UCLA, been director of the Heart Failure Transplant Program, and am honored to be part of Professor Federica Raia's research team.
I'm Federica Raia. I'm associate professor at UCLA in the Department of Education and in Internal Medicine.
Honestly, we're both really feeling privileged that we're not only partners in work and research, but also in life.
Yes, we're married to each other.
So the question that we've been discussing, what is actually burnout?
What is burnout? I mean, the idea is to be completely alienated from who you are and the beautiful work that a practitioner does. And so it's to be detached from it, not to have control of it, not to be able to control and own it, more than controls, owning it, your life as a practitioner and in the relation with patients.
The key core message that I would like to also share with young colleagues and future clinician colleagues is to make a decision to be in that moment. Because instead of being in the moment, there is a lot of temptation to be in something else but in this moment. For example, with my next patient or some other personal issue. So be in that moment, immersed in that moment, and be guided by the dyadic or triadic, however many persons are in that moment together, message that comes out of this. So it's not predictable exactly. It needs to be guided by what comes from the other person. And that is the secret, not only for the other person to feel taken seriously as a human being, but also for myself, immersed in that moment to feel a person walking out of the encounter and therefore feeling good and clearly not burned out.
So that's actually you touched on very important point. The last one is fundamental for our understanding of how to, for this series about wellness. I remember in our data, there are more than one time that we found a patient who cannot, or a family member who cannot deal with things. And so it never cries and never release any pain, something they had to deal with. And especially the person who's facing that or is facing, in the specific case, the possibility of embracing their own emotional journey to confront that, or a very difficult operation, or such as heart transplantations, or mechanical assist device implantations, or artificial hearts.
Yeah.
And those are important things that many of the patients have found that to protect the others in the family, or to protect, they don't allow themselves to share, and you seem to play an important roles there. So the question to you is, how do you protect yourself from being sometimes also destroyed by such powerful emotions into that?
I think, Federica, this is a beautiful question. I think the answer is, I am not destroyed by this kind of moment, but the opposite of it, because in my professional practice understanding my own personhood, my own spirituality, my own mortality is necessarily embraced by myself while having the eye contact and the contact established with the other person. It resonates between the two of us, the three of us, and therefore I resonate as a professional in a very existential aspect of my own being a professional and a person. That is why I don't have to divide myself, cut myself into pieces, and have a little bit professional identity there and the rest in my private life. That dichotomy, dualism, is what creates burnout. Integrating this is an anti-burnout, regardless of exactly how many hours per week I work, or exactly how many RVUs I'm doing, or exactly how many seconds I have per encounter. This is the secret.
As a couple, we do support each other through the difficulties of our academic lives. And of course, I know that Mario, for example, I'm not a medical doctor, but he is, so he has more space in my understanding of my role as his wife, and him as my husband. So I know that he likes good food, and I especially cook wonderful things for him when I know that he's having a tough time, or when he has a difficult cases, or when he's on call. And those are the days that I'm much more careful in what I can cook for you. And but especially we try to focus every day on something that was particularly helpful and beautiful in our day, and celebrate that part, so that the heaviness and the difficulties of dealing with death, dealing with pain, it does not overwhelm us, but allow us to be of comfort to others.
I agree. And is the other way around the same way when Federica, who is the head of her division in the School of Education and has a long day and organizing research in addition, is making her come home late, I'm going to do the Cantonese stir fry and everything is ready to go when she comes home.
Yeah, it is true. So it's really always, it's very similar to what we talked about before. It's about concentrating on the other and not on yourself, concentrating on helping the other or being there for the other, which gives you joy.
And that leads actually directly to the next point that's really key in this concept of relational medicine. What is the essence of relational medicine? It's basically your basic human right of being taken seriously as a person with your soul, mind, body, personhood, which requires me, that's the result of your years-long research, me to be in that encounter also as a person, meaning sitting down, handing my business card, establishing eye contact, being touching, being emotionally resonating. That gives you the sense of being taken seriously as a person and allows me to leave the encounter also feeling as a person.
One of the things that we see in our data is that a patient sometimes feels that the doctor has been in the room talking to them for a long time. And it turns out there's been there only 7 minutes. So our perceptions of time is not related to clock time, how many minutes we're there, but if the patients perceive that we're really there talking to them. And that's when we really concentrate on the other, talking about what it means relational medicine. I was so excited to be able to, and thank you for letting me videotape your interaction with your patients longitudinally for 2 years for each patient. So it would be important to design a research model to capture this, because when somebody describes what they do, it's different than when we do it ourselves or when we see it in a moment to moment. Even holding a patient's hand, it doesn't mean that you know exactly when to do it and when to release it. So small things.
Yes.
And so the method that I thought it was the best to devise was also, first of all, was a participatory research project where you and your team were working with us, researcher, as colleagues to study these practices and recording these practices longitudinally for each patient for at least 2 years. and then having time for with us reviewing this videotape audio recorded interactions, and together discuss it and see from different perspective what was going on with the patients, with the team, with you in particular, and with us researchers. And then from this, whatever was taken as important themes and moment, we did a deep analysis of interactions, the gesture, the gazes, the tone of voice, the prosody, along with what was said. Mario, there is another issue that we found in our research. This is, I'm referring to specifically one case about which we actually wrote a book, a longitudinal case of this patient who had to make important decisions. And those decisions about accepting certain LVAD or artificial heart or transplantations or bridge transplantations, and all the uncertainties, they're all around the case, because with the team, you discuss this. So we have all the work with the meeting of the team and the patients and family, the patient and family with each of the team members. And I was struck by in a few days, you enter the room every day and you repeat the same information over and over. And I never felt in your tone of voice or anything in your body language, I didn't feel any frustration. And I was struck by that because I felt, well, we're repeating this again. Can you tell me more about this?
Situational, the existential experience of the moment, what the patient needs to understand and to feel, that could guide the decision towards the next step. In other words, it may be a repetition 10 times of what sounds similar or identical, but what is evolving in this encounter is the wrapping around a decision process that is maturing. And that is only visible from the perceived shared encounter. It is not in any way scriptable and in that sense protocolizable. So it is only guided by the relational presence in the moment.
So what I hear is saying that the attention is not about how many times you said it, but is about when the patient is ready and the process of the patient of learning, understanding, let it sink, that really counts.
Absolutely, exactly like that. And part of the importance is here, while this encounter in the Relation Act is going on, it is very important not only to prepare for this Relation Act encounter, the continuation and initiation and continuation aspect, but also the conclusion. I cannot leave the encounter unless I feel the patient or the other person has all questions answered. In other words, I must allow silences also at the end before leaving. Otherwise, the encounter is not concluded in the way that helps the patient transition to the next step. In other words, personhood must be present without looking at the clock. And that is the prerequisite also for having any sense of not being burned out. And we're absolutely delighted if you can actually get back to us on feedback, but also on collaborative projects that could come out of this. You know that in addition to this first book that we've published on relation medicine, now the next one called Uncertainty is coming out, identifies already 20 themes that need to be incorporated in our practices. So yeah, I think we really would like to thank the American College of Physicians, the Southern California, the 3 region, team and for that beautiful Wellness Wave initiative that actually takes the wellness concept and being human, being respected in one's personhood, the anti-alienation, anti-burnout as a prerequisite for caring for the other person, often called the patient, in a most meaningful way in the concept of medicine.
Thank you.